Welcome to the OMMedicine's module on Chediak Higashi syndrome. So Chediak Higashi syndrome is a very rare condition that you are unlikely to come across in practice, but it is very commonly tested on your board exams, and therefore it's very important that you know some of the high-yield concepts about this condition that we will go through in the next few slides. Chediak Higashi syndrome is caused by the inability of lysosomes and phagosomes to fuse. And remember that phagosomes and lysosomes typically engulf substances, typically foreign bodies and bacteria, and then they will fuse together and destroy whatever that foreign body is with several enzymes that are specific to the lysosome and the phagosome. And one other important item to remember is that the way that most items are going to move in your body and the way that the lysosomes and phagosomes are able to be transported is via a network of microtubules. And so in Chediak Higashi, the real issue is with the microtubules and that they cannot transport the phagosomes and the lysosomes together to fuse, and therefore we get this condition. And so the mutated gene to remember for this condition is the LYST gene, and when you have a mutation in this gene, the microtubules do not work correctly, and therefore you get Chediak Higashi. And so the main takeaways from the pathogenesis of Chediak Higashi are that it is an issue of phagosome and lysosome fusion, and that is because the microtubules are not functioning properly, which is due to a mutation in the LYST gene. And that should be an easy gene to remember because it looks like lysosome, and the lysosomes are part of the issue in this condition. Now let's talk about the presentation of Chediak Higashi syndrome, because this is typically how your board questions are going to present a case to you. And so these patients cannot form the phagolysosome, which will typically engulf and destroy bacteria, and therefore you are going to get recurrent bacterial infections. Typically is going to be with staph and strep. Now recurrent bacterial infections is nonspecific, and so the way that you will really identify a case of Chediak Higashi syndrome, especially on your boards, is going to be by the way that the patients look. These patients are going to have very light colored skin, they have blue eyes or light colored eyes, they will have blonde hair or gray hair that typically has a metallic sheen to it, and all of these together are referred to as oculocutaneous albinism. And the oculocutaneous albinism is really going to be the major way that you will identify a patient with Chediak Higashi, because it's typically going to present in children, and most children do not have gray or metallic colored hair naturally. So once we have evaluated a patient who we think may have Chediak Higashi syndrome, how do we go about actually diagnosing it? And the diagnosis is largely going to be made by pathology. So pathology will look at the patient's blood under the microscope, and the characteristic findings for this condition are going to be giant granules within granulocytes and within platelets. And now you can also see giant melanosomes. However, the giant granules in granulocytes and platelets is going to be the major finding that's associated with Chediak Higashi. And once you've done all of these steps, the definitive diagnosis is going to be with genetic testing, looking for one of those mutations we previously talked about, most commonly the LYST gene mutation. Now that we've talked about the diagnosis of Chediak Higashi, let's talk about the treatment. And unfortunately, there's really no good treatment for this condition. Unfortunately, most patients are going to die before the age of 7, and the treatments are largely going to be symptomatic or prophylactic in nature. So you can give these patients G-CSF, which stands for granulocyte colony stimulating factor, to help increase their leukocytes and their white blood cells. You can also give them prophylactic antibiotics, because remember, they're going to have increased susceptibility to infections, specifically bacterial infections of staph and strep, and so you want to make sure that they can have some extra help fighting these off with antibiotics. And ultimately, the best treatment that you can give these patients is an allogenic hematopoietic cell transplant. And unfortunately, as we already discussed, despite all of the best treatments, most of these patients are going to have a poor prognosis with death before age 7. Now, if they are able to survive longer than that, they are going to be plagued with many complications. Two of the most common ones are going to be neurologic deficits, so they will have peripheral neuropathy, and many of them are going to be wheelchair bound because they cannot walk due to this debilitating neuropathy of the lower extremities. And the other complication of Chediak Higashi is hemophagocytic lymphohistiocytosis, which is a bit out of scope of this video, but it's just important to be familiar that this is a common complication of those who live longer with Chediak Higashi syndrome. So for your board exams, it's important to be aware of how they typically phrase questions. And for Chediak Higashi, they will typically give you a question where the patient has the oculocutaneous albinism, and they describe a young patient with gray hair or very pale skin and blue eyes, and they will ask you something about the pathogenesis of the disease, whether it's phagolysosome fusion, microtubule dysfunction, or possibly even the LYST gene. And that brings us to the end of this module on Chediak Higashi syndrome.